We have Patrick Allen, Director of the Oregon Health Authority, Dr. Dana Hargunani, Chief Medical Officer at the Oregon Health Authority, Joe Ness, the Chief Operating Officer at OHSU, and Melissa Unger, Executive Director of SEIU Local 503. And they'll be talking to you about COVID-19 vaccinations in Oregon. And without further ado, Director Allen, let me turn it over to you.
Great, thanks, Rob. Again, I'm Patrick Allen, Director of the Oregon Health Authority, and I'm joined by Dr. Dana Hargunani, our Chief Medical Officer. Welcome to our regular weekly media briefing and the first briefing for the year. As Rob indicated, we've been joined by Joe Ness from OHSU and Melissa Unger from SEIU. They're here today to talk about their collaboration to help get more vaccines out to SEIU members working in frontline healthcare roles. What we want to do today is give you an update on where we stand in our COVID-19 vaccination effort. We'll cover our current expected vaccine allocations and how we're distributing the vaccines, where we are in the prioritization process, and the steps we're taking to scale up Oregon's vaccine program and achieve Governor Brown's goal of 12,000 vaccinations per day in the next 2 weeks. Let's go to the next slide, please. Here are some of the key points that we want to cover today. Our pace of COVID-19 vaccinations is on par with other states, but there's more we can do to accelerate our progress. According to CDC data, Oregon currently ranks 36th in the nation in vaccine distribution, with more than 1.2% of our population having been vaccinated as of yesterday. Washington is just ahead at 1.3%, and California has also vaccinated 1.2% of its population, just for comparison of our West Coast neighbors. While we're right in line with most other states, that's not enough. We've outperformed nearly all other states in containing the COVID-19 vaccine or virus and in preventing COVID-19 deaths. Now we need to outperform other states in getting our state residents vaccinated. This isn't about our state ranking as a point of pride. Because so few Oregonians have contracted COVID-19, our state remains particularly vulnerable to the virus. COVID-19 vaccines are safe and extremely effective. We need a critical mass of Oregonians to get vaccinated to protect ourselves, our families, and our communities and return to our normal way of life. In the first 19 days of COVID-19 vaccinations, we've learned some key lessons we'll use to speed our vaccination efforts. Every flu season, Oregon vaccinates about 1.5 million people in about 4 months. However, COVID-19 vaccines are different. We're adjusting to the unique distribution, storage, and prioritization requirements we've experienced in the first 3 weeks or so of this process. So far, Oregon has been good at getting vaccinations in the arms of people assigned to a specific location, like a hospital worker or a resident at a skilled nursing facility. Now we need to up our game for people outside those locations. We're taking 5 specific steps to continue to rapidly expand the number of doses administered in Oregon. Based on the lessons we've learned in the first 3 weeks of distribution, we're taking specific steps to adjust the prioritization process in Oregon. We've run the first 500 yards of a marathon, but what we've learned in this time will help us run faster toward the finish line of ending the pandemic in Oregon through our vaccination effort. We'll talk more about these points in this briefing and give you a chance to ask questions. Next slide, please. Let's start with an update on our state allocation from the federal government and the number of doses we've distributed to hospitals and other partners. While our initial allocations of vaccines had been reduced from their first projected levels for last week, the federal government did deliver on the revised numbers it promised. Last week, Oregon received 34,125 doses of Pfizer vaccines for a total of 93,600 doses from Pfizer that have been delivered to vaccination sites as of January 3rd. We also received 24,800 doses of Moderna vaccine for a total of 96,900 Moderna doses that have been delivered to vaccine administration sites again as of January 3rd. Of those doses, 167,100 have been delivered to hospitals, local public health, and first responders to be able to deliver vaccines, and 23,400 have been delivered directly to pharmacies to vaccinate staff and residents at skilled nursing facilities as part of the federal pharmacy program. Now let's look at the number of people who've been vaccinated in Oregon, how Oregon compares to other states, and the lessons we've learned in this process. As a reminder, we're currently in phase 1A of our vaccination effort. In this first phase, we're starting with healthcare workers and residents and staff in nursing homes and other long-term care facilities. We're currently in Group 1, which includes staff who work in hospitals, urgent care settings, skilled nursing and memory care facilities and residents, tribal health programs, EMS providers, and other first responders, among others. Other people who are eligible for Phase 1A vaccinations are divided into 3 additional groups, which include people who work in congregate care sites, such as nursing homes and residential behavioral health programs, outpatient providers who serve specific high-risk groups, home health providers, all other outpatient providers, and public health programs, and a range of other frontline roles. Dr. Hargunani will talk more about the interplay between the prioritization process and our channels for distribution in a moment. This is a critical dynamic we're focused on in our effort to ramp up vaccinations in Oregon. But for the moment, let's look at the numbers of vaccinations that have been administered in the state. As of the week that ended Sunday, January 3rd, 51,264 doses of vaccine had been administered across Oregon. That includes 31,480 doses of the Pfizer vaccine administered through hospitals and other healthcare facilities, and 19,789 doses of the Moderna vaccine administered at healthcare facilities and skilled nursing facilities. Overall, approximately 1 in 4 doses of vaccines that have been sent to healthcare facilities or to pharmacies for use in skilled nursing facilities have been administered, exactly the same percentage as California and a percentage point behind Washington. While this slide shows that 9 people have received second doses of the Pfizer vaccine and have been fully immunized in Oregon, that number has already jumped to 326 as of today, and will continue to increase as second dose shipments are processed at local hospitals. We've not received any reports of spoilage from sites that are administering the vaccine, and that is something that we keep track of. Vaccines are being handled and administered in a proper and timely way. As Governor Brown stated, our target has been to ramp up to 12,000 doses per day at the end of next week, and we fully expect to reach that goal by that time. Yesterday, we added an additional 2,818 doses administered, which brings Oregon's total to 55,239. Now, I'd like to turn it over to Dr. Dana Hargunani, our Chief Medical Officer, to talk about what we've learned so far and the adjustments we're making to the COVID-19 vaccine distribution and administration process. Dr. Hargunani?
Thank you, Director Allen. I'm Dr. Dana Hargunani, Chief Medical Officer at the Oregon Health Authority. I'm also a practicing pediatrician, and as a pediatrician, I know vaccines are a vital tool to help stop the spread of disease. As Director Allen stated, the COVID-19 vaccines are safe and effective, and they are the most reliable tool we have to protect ourselves, our loved ones, and the people around us from COVID-19 and end the devastating impact of the pandemic in Oregon. At the same time, these safe and effective vaccines have posed new challenges to our robust system of vaccine distribution in Oregon. Next slide, please. Here are some of the lessons we've learned in the first 2.5 weeks of the distribution process. First, COVID-19 vaccines are different than flu vaccines. Distributing and administering large numbers of COVID-19 vaccines is different than distributing and administering large doses of influenza vaccines. And here's a couple reasons why. We're rolling out a new vaccine in a pandemic. Scheduling, physical distancing, and the observation period immediately after a vaccine is administered all have an impact on the logistics of organizing mass vaccination events. 2-dose regimens for the Pfizer and Moderna vaccines also demand specific tracking requirements, so data can be entered into our alert data system and patients can be notified when and where to go to get their second dose. This makes it harder to organize, again, these large vaccination events, which you might see normally in response to a meningitis outbreak, for example. Also, ultra-cold storage. The ultra-cold storage requirements of the Pfizer vaccine make it especially complex to distribute and administer. OHA is purchasing more ultra-cold storage units for more hospitals, but the current storage capacity among Oregon hospitals requires us to focus where and how we use the Pfizer vaccine. Prioritization of the vaccine imposes operational complexities that we're continuing to address to as well. The hard reality in Oregon and every other state that we face is that there are simply not enough doses vaccine doses to go around, and there won't be for many months. As a result, all states must prioritize. The prioritization process means we can't rely on the standard vaccination distribution process we've come to rely on. So we're making adjustments and adaptations as we learn. For some groups, the distribution process has remained relatively simple because we can leverage pre-existing pathways. For example, hospitals know how to vaccinate their own staff, and skilled nursing facilities are using relationships with pharmacies for on-site vaccinations. For other groups, it's a more complex process. For example, vaccinating healthcare workers who aren't affiliated with a hospital, such as an outpatient pediatrician like me, requires Oregon healthcare system to forge new temporary relationships. So 1A distribution, let's talk about how the dynamics of prioritization affects the logistics of distribution. The process for vaccinating inpatient healthcare workers and staff and residents at skilled nursing facilities, again, is relatively straightforward. Hospitals vaccinate their staff, recognizing the immediate logistical challenges and constraints these new vaccines pose. Pharmacies, under long-standing Medicare Part A contracts with the federal government, go on site to vaccinate residents and staffs at skilled nursing facilities. However, as we move deeper into the groups 2 through 4 of the Phase 1A distribution plan, the process becomes much more complicated. Hospitals and Part A pharmacies can't vaccinate everyone in the 1A prioritization group because they don't have standing vaccine administration relationships or the capacity, or at the moment, all the doses necessary. Existing vaccine administration entities, such as retail pharmacies and local public health authorities and clinics, know how to vaccinate people, but their capacity needs to be leveraged in a timely and efficient way. And they need to manage the logistics of prioritization. For example, retail pharmacies aren't experienced in giving vaccine to people in priority occupations, such as healthcare workers, while withholding it from others who aren't eligible. As a result, we need to expand the number of administration sites and forge new collaborations to deliver new COVID-19 vaccines in new ways among all of our healthcare partners. Next slide, please. OHA is taking immediate action steps to adjust based on what we've learned, which will accelerate the pace of vaccination in our state. Here's what we're doing. Effective this week, we will first speed Phase 1A prioritization by simplifying the staging and sequencing amongst groups. We plan to move through the 4 Phase 1A groups in stages. We understand from our hospital partners that most hospitals are moving through their inpatient staff. Now that most inpatient staff have received their first doses, we're going to simplify the Phase 1A process and allow to move forward to groups 2 through 4 to seek vaccination. We expect this step will reduce delays and rapidly increase the number of doses we can administer each day. We are communicating this change to our local partners. Next, we're going to speed the number of doses delivered to nursing home staff and residents by activating Part B of our federal pharmacy partnership. Oregon will be activating Part B of the Federal Pharmacy Partnership Program to serve additional long-term care facilities within the Phase 1A. Oregon will work with CDC and Walgreens, Consensus, and CVS pharmacies to activate the second phase of the Federal Pharmacy Partnership Program as soon as possible. We are working with the pharmacy partners to finalize a facility list to understand who will be met during this program. We expect participating facilities would include groups like adult foster homes for older adults, adults with disabilities, adults experiencing behavioral health issues, people with intellectual and developmental disability, and group homes for people with intellectual and developmental disability and behavioral health residential treatment homes and facilities. We are working to better understand who will all be met, whose needs will be met as part of this program, and make sure we're working with others. We anticipate this change that I've outlined will speed vaccinations to approximately 80,000 staff and residents. Next, we're going to speed the number of doses delivered to healthcare workers and other Phase 1A groups by giving them the option to get vaccinated at retail pharmacies. Retail pharmacies are a key component in our annual flu vaccination efforts, and we expect them to be a vital part of our COVID-19 vaccination campaign. While we plan to leverage retail pharmacies as part of our vaccination efforts for critical workers, such as in phase 1B and later groups, we're exploring how we can quickly make this capacity available to healthcare workers in phase 1A. We're also going to make more doses available to phase 1A workers by leveraging every available public health capability at our disposal, from our local public health authority partners to volunteers as part of our Serve Or program. Our local public health departments are eager to help. We have trained medical volunteers we can call on to support vaccinations among priority populations on the ground in local communities. We're going to accelerate our efforts to call on these resources for the phase 1A populations. And finally, we're going to speed the number of doses delivered to unaffiliated healthcare workers, nursing home staff, and others by supporting innovative partnerships, such as the collaboration between OHSU and SEIU to launch mobile vaccination clinics. Here to talk about this partnership are Joe Ness, Chief Operating Officer at OHSU, and Melissa Unger, Executive Director at SEIU Local 503. Joe and Melissa.
Great. Thank you, Dr. Hargunani. I'll start. Good afternoon, everyone. I'm Joe Ness, Chief Operating Officer and Senior Vice President for OHSU Healthcare. And thank you all for the privilege of being here today. As the state's public academic health center, OHSU's singular focus and core mission is to improve the health and well-being of all Oregonians. We are a community of healers who care deeply about Oregon's most vulnerable residents and are ready and willing to do anything to assist the state in vaccinating and caring for all of our communities as quickly as possible. Since the first vaccine shipment arrived to us on December 15th, OHSU's employees and learners have been volunteering to administer vaccines 7 days a week over the holidays. And over the past 3 weeks, we have demonstrated our ability to administer vaccines quickly and effectively. Currently, we're administering approximately about 1,000 doses a day and are likely to have capacity to do more. We have vaccinated about 12,000 OHSU members, and our students, employees, and trainees are now turning their energy, focus, and expertise to getting vaccines in the arms of as many Oregonians as possible. Today, I am pleased to announce a new partnership that will help us reach that goal. OHSU and Service Employees International Union will launch a pilot program within the next couple weeks on OHSU's South Waterfront campus to begin the process of vaccinating Oregon's 32,000 home care workers and tens of thousands of patients starting in the Portland metro region. We have been asked for a commitment from the state. We've asked for a commitment from the state of about 3,000 vaccines per week to move forward with this program. There's a potential to expand this program and programs like it to other hospitals and health systems, but it can only exist if there's a strong commitment from the state to move quickly. We understand that distribution system is imperfect, but we cannot let that get in the way of protecting health and safety of millions of Oregonians. We must act quickly to vaccinate all Oregonians. Thank you.
Thanks, Joe. I'm Melissa Unger, and I'm the Executive Director of SEIU Local 503, and we represent 72,000 members throughout Oregon, including 35,000 long-term care workers, including nursing home workers, adult foster home providers, and home care workers. Throughout this pandemic, we know that long-term care workers have been on the front lines of this crisis, putting themselves and their families at risk to care for some of the most vulnerable residents. Home care workers are often an invisible part of the long-term care workforce, going into homes of consumers across the state, keeping them safe, but not getting the protection and support that they need to make sure that they can keep their consumers safe and their families safe. They are a critical part of the healthcare workforce. And we really believe that this vaccine will allow workers and consumers across the state a sense of security as the virus continues to impact communities in every region of the state. Yet home care workers are uniquely difficult to vaccinate in group because they do not have a central employer or work site, and they work in every corner of the state and speak many, many different languages. And so we're really hoping that working with OHSU to set up a pilot in Portland that can hopefully, or in the metro area, to expand, will show that we can move a program to vaccinate people quickly. And that groups like us, unions and advocacy groups that have existing relationships with Oregonians and vulnerable populations can be partners in how we think about speeding up the vaccine process. This should not be complicated. We need to work with willing healthcare providers and trusted sources to get people vaccines and make sure that frontline essential workers and the people most at risk by the virus are protected as quickly as possible. And we're really hopeful that this collaboration will give us a path to do that, that we'll be able to work with home care workers and their consumers and then expand that to additional essential workers and vulnerable populations. And we're excited about working with OHA and OHSU to make this happen throughout the state.
Thanks, Joe and Melissa. We really appreciate your collaboration. The COVID-19 pandemic has tested our resilience and our adaptability at pretty much every turn in every aspect of our lives. Oregon has one of the most effective systems in the nation for delivering vaccines, but the virus is testing the adaptability of our immunization program too. These actions will build on our current strengths to increase Oregon's COVID-19 vaccination capacity and accelerate our progress through Phase 1A. In turn, speeding the pace of Phase 1A vaccinations will enable us to get to critical workers, vulnerable populations, and then the general population sooner. That'll save more lives and end the pandemic in Oregon sooner too. I know you have questions, so let me wrap up quickly with today's COVID-19 numbers. Today, Oregon's reporting 1,059 new cases for a total of 119,488 COVID-19 infections. Sadly, we also reported 44 new deaths, bringing our death toll to 1,550. Staff at OHA, in our local hospitals and in nursing homes, local public health departments, and in tribal health authorities are working literally day and night to administer the COVID-19 vaccines. Yet these numbers are a reminder that we can't drop our guard. A COVID-19 vaccine is the safest, most effective, and most reliable way to prevent yourself, your loved ones, or your neighbors and coworkers from becoming infected with COVID-19. But as we roll out the vaccines, all of us need to keep taking the steps that have saved thousands of lives in Oregon and staved off the worst extremes of the crisis that we've seen in other states. Keep wearing masks, maintain physical distancing, minimize indoor social get-togethers, and stay home if you feel sick and wash your hands well and often. With that, I think we'll go ahead and open it up for questions.
Okay, before we do, I just want to remind everyone we are recording. So I know members of the media have asked if there'll be a recording available, and we will post it online at the conclusion of this media briefing. As a reminder, again, welcome your questions. If you're a member of the media and you have a question, go to the chat function and send a message to the OHA host that you would like to ask a question and identify yourself and your outlet. We will put you in the queue and we will ask your question as soon as we get to it. And now let me go to our queue. And the first question is from Rachel Alexander at the Salem Reporter.
Thanks. Can you hear me?
Yes.
Okay, great. Hospitals in the Salem area are telling me that they've received more vaccine doses than the number of employees and volunteers that they have, and they're awaiting guidance from OHA about how to roll those vaccinations out to other 1A groups beyond their employees. I'm wondering why OHA hasn't provided guidance for that and when you expect that will be available.
Dr. Hargunani, do you want to take that one?
Sure, thank you for the question. I think as I outlined in my talking points today is that shift that we're making as we open up further groups in the Phase 1A, we've been in direct conversation with our hospital partners so that groups can move forward, like Salem Health, to do some of the vaccination for others across Phase 1A. And so I think that's a good example, and working on continuing to get more guidance out.
And I do know that Salem Health has been working with Marion County Public Health, and in fact are getting ready to move forward with community vaccinations of other 1A individuals, I believe this week.
Okay, next question is from Caleb Lay at The Observer.
Thank you. Can you hear me?
Yes.
Okay. So with the 12,000 vaccinations per day that the governor wanted to achieve, I think that puts us on track to have 2 doses of vaccine for every Oregonian available sometime in late November, early December of 2022. So my question is there any realistic scenario in which Oregon can achieve herd immunity in 2020?
Thanks. Great question. And that's really contingent on the size of the federal supply. That rate of vaccination is consistent with what we now expect to receive, at least for the next month, which is about 75,000 first and second doses per 75 to 100,000 first and second doses per week. And you're right. If that's the pace that we continue to receive vaccine at going forward, it'll take a long time. Potentially as production at the 2 existing manufacturers ramps up, as the federal government elects to purchase more from Pfizer, for example, or as other vaccines come online, that should increase the supply, and we would then work to increase our ability to provide those vaccines.
Okay, next question is from Milo Mimica from KGW.
Hi there. So we reached out to the National Guard because we had a lot of viewers asking if you guys are going to connect with them about them helping distribute the vaccine in the coming months. What can you say about that?
We don't have plans to use the Guard at this stage. That could change over time. One of the challenges with this vaccine and with COVID-19 generally is how you overcome vaccine hesitancy and how you work with populations that are disproportionately impacted by the vaccine and have a historic distrust of government organizations and entities. And so right now, where the gaps that we're working on and the places where we expect there to be challenges around vaccinations aren't a great match with the Guard. As I say, that could change over time. We could end up with different kinds of gaps that we want to address that way. But what we're really focusing on is community-based organizations, organizations that have relationships with the hardest to reach populations. I think what you've heard about today with SEIU, OHSU partnership is a great example of how to work with directly with communities to facilitate vaccination.
Okay, our next question comes from Lisa Balick at COIN.
Yes, hi. I guess I'm still not understanding how you're going to get up to the 12,000 doses a day in quickly. I mean, there's tens of thousands of doses that are sitting around in boxes. How are you going to get them used, let's say, even in the next few days?
Sure. So I don't think we're going to get to 12,000 doses in the next few days. I think we like most other states around the country and most countries around the world are ramping up this distribution. I don't think I mentioned it in my talking points, but 27 states I think are sitting at about 1 to 1.5% of the population vaccinated so far. So we're all in this stage of gradually increasing our vaccination over time. We talked about opening Part B of the federal pharmacy process, and that right now we're vaccinating a fairly small slice of long-term care, which is skilled nursing facilities and some memory care facilities. That Part B widens that very significantly to a variety of different congregate care settings. And then being able to open retail pharmacies as a chain for other individuals is a big piece. Then we're also, similar to what Joe and Melissa talked about for OHSU, opening various hubs based on hospitals. We talked a minute ago about Salem Health working with Marion County Public Health on opening up to vaccines beyond its own staff. So I think we've got a number of lines in the water to open up more channels and get more vaccine out, and we'll continue to see that process ramp up over time.
Next question comes from Simon Gutierrez at KPTV.
maybe Simon's on.
There, can you hear me?
Now we can.
Yep.
Reading today in the New York Times, the Surgeon General has stated publicly the states should move quickly to other priority groups based on the slow rollout so far. Is there any consideration to do that, especially with the example of Salem Health having more vaccines than they need? I'm sure that's not unique to them. Is there any consideration to move down the line more quickly? I mean, the Surgeon General said specifically, go to 1A, then go to 1B, and go on down the line until you get rid of the vaccine.
Yeah, we're basically doing a version of that that Dr. Hargunani talked about. We had originally expected to go through 1A in 4 different groups. And now what we're doing is moving forward to open all the remaining groups of 1A. That's about, all of group 1A is between 300,000 and 400,000 individuals, including long-term care residents and staff. And so we're not ready to move to 1B just yet, but that is exactly the strategy that we're following.
All right, next question is from Amelia Templeton at OPB.
Yeah, I need help understanding how the changes you're making to the Federal Pharmacy Partnership Program are going to mean faster vaccinations for people in long-term care. And specifically, I'm wondering what % of the 23,000 doses you say have gone into that program so far have actually gotten into people's arms? And if putting more vaccines into that program will change the number of pharmacy staff on the ground here, or why you think that's going to speed things up?
Yeah, it's a great question and a fair point. The federal pharmacy program is not one that we have a lot of direct control over. We don't actually have any direct control over it. It's a 100% of federally contracted program. Our understanding is that those pharmacies have the ability to roll out more teams and have more individuals involved in vaccinating. And so what we're doing is opening the range of care settings that can be vaccinated. Partly why that's helpful is although there's a range of the way facilities are set up, frequently what they're set up is a multi-licensed campus. And so you'll have wings or buildings where one is a skilled nursing facility and another is a secure memory care facility. And then there's long-term care and assisted living. And they're all basically in the same general location. They've got some degree of separation from each other. But what we've been doing right now basically is saying, go to site A and vaccinate the skilled nursing and memory care people, but not the rest of the people. And so what this allows is for that team that shows up to be able to vaccinate more of the residents at a particular location.
Our next question is from Melanie Zermer at KMUZ Radio. Melanie?
Can you hear me?
Yes.
Okay, so I'm from the Salem area, and I heard that Kaiser Permanente has been reaching out to its older patients, talking to them about getting ready for the vaccination. But at Salem Clinic, there have been no communications to the patients. Is there anything about this that you can explain further?
I might ask Dr. Hargunani to comment. My sense would be there's a difference between get ready to think about getting vaccinated and hard plans. We're not ready to move to seniors generally. That's a 1B. That's a 1B category likely. And so I think I would explain it as Kaiser is kind of trying to get ahead a little bit and the others not quite as much. But Dr. Hargunani, do you want to comment?
Sure, Director Allen, I would agree. I think every clinic and practice has a different approach for how they're preparing and communicating with their patients in anticipation of this vaccine becoming more broadly available to their population. So I anticipate it's part of those differences and approaches that they're taking.
All right, next up is Lynn Terry from the Lund Report.
Yeah, thanks for taking my question. I'm just wondering that when Dana mentioned about going to non-affiliated healthcare workers who don't work for a hospital. I'm just wondering, when do you expect to start vaccinating them, and how exactly is that going to roll out? What do you have planned for the pharmacies? Is there going to be a mobile unit run by OHSU? How exactly is that going to play out, in what time frame? Thanks.
I can speak to that. Thanks for the question, Lynn. I think it's actually going to look different in every community as each of the partnerships that are evolving in those places are building off of their resources and partnerships to make this happen. I think the partnership that we heard about today from OHSU and SEIU is an example of such a partnership. So some systems will have a mobile van unit that could be a resource to deploy in their community. As earlier mentioned, we're aware that Salem Health and their local public health partner are readying for a community event targeting others in phase 1A. And so I think these partnerships that are longstanding and building new innovations are going to be part of some of those reach out to unaffiliated healthcare providers, and we'll continue to see those opportunities build here in the coming few weeks.
The next question comes from Megan Glova at the Central Oregon Daily News.
Yes, hi, can you hear me?
Yes, we can.
Great. I just wanted some clarification on how exactly it's decided how many doses of the vaccine are distributed to each individual county.
I can speak to that. And this, as we evolve our approach to how we're sequencing and opening up groups for vaccination, that will look different. So it is in evolution. For example, for the very first group in group one in our very first phase, some of the information that we used to distribute vaccination doses were based on information provided through surveys from our hospitals regarding their employees that fit into group one, for example. Also, work we did with our long-term care facilities to enumerate their residents and staff to support those allocations to our federal pharmacy partnership. We're continuing to gain that type of data to support in making distributions across all the counties in Oregon. So again, this will evolve as we move through different phases and the data we use to inform that based on where we are in our sequencing.
Next question is from Genevieve Rayom from K2.
Hey there, thanks for taking my question. I have a few because I am on the call for my colleagues as well. So I'm gonna get to my colleague Lachey Wesley's question first. And I know there's been a lot of talk about pharmacies and the role that they'll play in this, but is OHA recruiting other providers to administer the vaccine, like retired nurses, or we've heard that other states are considering optometrists. Is there any word that will expand that way?
Thank you for the question. I mentioned the partnerships we have through those who have enrolled in our Serve Oregon, which is a volunteer group who can be further utilized in our vaccination efforts. And those include, for example, the types of retired healthcare providers you're speaking to. So again, matching some of the local resources and personnel that might be in already partnership to additional resources we have through this statewide volunteer service corps are examples of what we'll be doing.
Other examples would include OHSU deploying dentists and dental students as part of its effort. University of Portland nurses are working in partnership with Kaiser Permanente. Nursing students, are working in partnership with Kaiser Permanente. A couple of other examples.
Okay, thank you. And then the question that I had is, just yesterday I was talking with OHA and I asked specifically if the 10,000 daily dose goal that Governor Kate Brown had previously said, if that was too aggressive, and was told that it was likely a bit optimistic. And then just hours later, Governor Brown came out with this 12,000 goal. Did something change in those few hours, or were you guys aware that this was going to be the new expectation?
Well, I think 12,000 you do the math and look at the amount of vaccine that we expect to receive from the federal government, and that is the amount that we need to get out to use that vaccine. That number will likely need to increase, not likely, it will need to increase over time. as supplies increase. So, I think we're all going to have to work really hard to vaccinate people as quickly as we can, and that target is a target that we do in fact need to achieve.
And could you explain the communication between OHA and the governor? Was this expectation something that you had discussed together, or was it something that the governor had decided and then passed on to you?
No, I discussed it with governor's office staff.
Okay, thank you.
Next up is Ben Botkin from the Lund Report. Ben? Okay, we're going to move to Elizabeth Hayes at the Portland Business Journal.
Can you hear me now?
Yes.
Okay, great. Sorry. So there's been some talk and discussion about, and not in Oregon particularly, but of maybe just doing one dose and getting it out to more people. Is that anything that is on the table here? And then also, if I could just ask one other, I was wondering about like kind of where the backlog, if you will, is. I know when I talked to OHA yesterday, about 26% of the doses that had been received have been administered. But when I talked to the hospital systems in Portland, they had done a way higher percentage. So just wondering where that gap is.
Thank you for the question. I can speak to the first to start. We are aware of some of the information being discussed about considering one dose over the currently recommended 2 doses. We continue to look at that information and research, but we're also quite aware of the FDA statement that was released today, really recommending to keep on the 2-dose schedule due to a lack of evidence. So at this point, we have no plans to change and keeping a close eye on the information forthcoming.
Also, I believe the Western States Scientific Review Group that participated in reviewing the safety and efficacy of the vaccines is also looking to assess what the state of the science is on that point. But at this time, we don't have any intent to change to a 1-dose regimen. On the other issue, Elizabeth, I think you'll find the doses are here and there. We just pushed out 25,000 doses to local EMS and public health. And so that's some of it. We've got doses going out today and tomorrow to federally qualified health centers. I think the uptake is uneven across different hospital systems. So some are very high and have used lots of the doses. Others, I think, are less so. And so it's hard to characterize it as any one thing.
Next question is from Chris Severance from KGW.
Great. Thanks so much. My question is for Patrick Allen. Mr. Allen, you said at the start of this news conference, we're 36th in the nation when it comes to vaccinations based on population. But if you look at shots in arms, so the vaccines administered compared to distribution, we're 45th. And that's based on the CDC numbers and then the 55,000 number you just gave on this call. What do you say to people who believe it's unacceptable?
Well, I'm not sure I agree with your numbers, but I think I would like to be going faster too. The whole world would like to be going faster than we are with this vaccine right now. We're at the beginnings of a long race. We have known all along it's going to take months to get this vaccine out. Like everything else with COVID, we take actions, we learn from those actions, and we improve as we're going. And that's the exact same thing with vaccination. We want to continue to build those numbers, and that's exactly what we intend to do.
Next question is Rob Kuznia from CNN. Rob, are you still with us?
Yes. Sorry. Can you hear me?
Yes.
Thank you. I was just wondering what your assessment is of the guidance that you've gotten from the federal government in terms of distributing the vaccine as quickly and effectively as possible. And what have been the biggest challenges in this regard, and what, if anything, could be changed to improve the process?
So I think some of the areas that we continue to give attention to are monitoring the pace at which we're able to continue to get vaccination doses here in Oregon. And also the pace is already mentioned with the federal pharmacy partnership that's managed at the federal level. Those are all really important things for us to continue to accelerate the pace of vaccination in Oregon, and areas that, our relationship with the federal government and information flow is really critical.
Next question is from Julia Silverman at Portland Monthly Magazine.
Sorry, I'm here. Can you hear me?
Yes, we can.
Okay. I'm wondering, since the governor's announcement on December 23rd about a change in guidelines for school reopenings, I'm wondering if you can give us more information of how teachers might get their vaccines, whether they'll be working with county health departments, and if OHA has any specific guidance available on that. Thank you.
Yeah, I can take a crack at that. Education employees, so broader than just teachers, classroom instructional assistants, bus drivers, nutrition workers, all that are covered. Will go first in the 1B category as critical workers per the governor's instructions. And like a lot of this, how exactly that happens will vary geographically across the state. There are counties that are set up to be able to do that through local public health. In other places, that may be most effectively done through hospital-based hubs or using retail pharmacies. As we get closer to that group, which we expect at the current rate of receiving vaccine to be able to be at by mid to late February, we'll be able to work with the 190 school districts across the state and educational service districts to provide more detailed, more local instructions about how to proceed.
The next question comes from Ben Botkin at the Lund Report. Ben? Okay, looks like Ben's continuing to have some technical difficulties. Let's move on to Aaron Ross at OPB.
Hi there. So it's from the hospitals that we've been speaking to most recently, it kind of sounds like there's sort of issues in getting the vaccine to where it is needed. I've heard from several hospitals where we have, where like some people who are working with patients still haven't been vaccinated. And then like at other hospitals, they're trying to find people to get vaccinated and like begging them to take these doses. And I know some of that is probably because of just the size of the initial doses and the smaller size of healthcare populations. But with what we're seeing right now with kind of this like slow roll to get like the actual pokes in the arms, is there anything that you guys are looking at doing to kind of even out that distribution or to help some of those areas that are lagging? What can be done?
I can speak just to say point out a couple things that I think we've mentioned, and I think which are specific to this. So one, you actually did mention the dose number. So we have limitations in the minimal number of doses that can be shipped at once. And so that might look different for a smaller hospital in terms of, versus their need compared to a larger hospital, for example. The uptake in vaccination might look different across hospitals as well, initially. And certainly we also know that the vaccine rollout has occurred over holidays. And so people being on vacation and such might have impacted the rollout by individual hospital. And I think, as we articulated earlier, moving from this very focused sequential approach by starting with group 1 and completing before going to group 2, I think opening up phase 1 will allow for some of those flow of doses more readily.
Okay, next question is from Amy Green at the Oregonian.
Hi, yes, you can hear me?
Yes, we can.
Okay, great. I'm wondering in 1B, will people age 75 and older be vaccinated at the same time, simultaneously with school employees?
So that's a decision that the Vaccine Advisory Committee will make in terms of who besides school employees will be prioritized where and when. Governor's directed that school employees will go first. And what else could go at that same time will really depend on what our supply situation at that time looks like. It could be that we have enough vaccine supply and enough infrastructure in place to do more than just school employees, but our first obligation is to follow the governor's directions and get those school employees taken care of.
Thank you.
I'm going to ask a question on behalf of Ben Botkin from the Lund Report. Can you please outline any plans and efforts to administer doses to dental providers?
I can speak to, dental providers alongside many other types of providers in the outpatient setting are part of group phase 1A. I know that there are plans underway by various groups and partnerships emerging, similar to what I think Joe and Melissa outlined today, to be able to now extend vaccinations out to broader groups again in phase 1A. We've been really focused on that very first group, looking at hospital capacity as one of our primary goals to be able to maintain with vaccination, as well as our addressing the big impacts to long-term care facilities. So dental providers are a part of this phase 1A, and now that we're moving forward, I think we'll have more planning and operations underway to get there.
Okay, in the remaining time, we're going to come back to some follow-ups. First is from Caleb Lay at The Observer.
Lucky me, I get to. So if we're looking at a year or more before we potentially reach herd immunity, doesn't it become critical to establish whether or for how long these vaccines provide protection from COVID-19? And if they don't provide that long-term protection, which is still unknown, then don't we run the risk of being right back where we are a year from now?
Yeah, I think you raised some great points. The federal government has encouraged us to believe that they will acquire enough vaccine at a faster pace to get to a level of full vaccination by sometime in the summer. A lot of people have speculated that that's pretty optimistic. I don't want to try to guess one way or the other, and it's also a little bit of an open question of what level of vaccination do you need to achieve to get to herd immunity. I think one of the advantages we'll have in Oregon is the combination of vaccines working together with our 4-tier risk-based metric structure. And our focus on long-term care early in the process. We've elevated more long-term care into phase 1A. About 40% of our fatalities in Oregon, which are the third lowest fatality rate in the third or fourth lowest fatality rate in the country, but 40% of them nevertheless come in those care settings. And so even if we're short of herd immunity, we ought to be able to improve the situation significantly in the state, save lives, be able to see a lower infection rate while we wait to answer some of these questions. Because you're right, there are some big variables in there in terms of production, in terms of length of immunity, all the level for herd immunity that we really just don't know right now. But I don't think I think we're going to be able to make progress and make things better even without knowing those things.
Next question is from Gary Warner at EO Media.
Okay. Now can you hear me, Rob?
Yes.
Okay, thanks. I know you guys don't like to look way down the line, but that's what I think a lot of our readers want to know. We're doing our own math, which I would prefer not to do. I'd rather have your math. But by my own math, if you're doing 12,000 doses a day with 4.21 million people in Oregon, if you're going to do everybody, you're looking at the end of December. If you're going to look at the 75 or so, 70% who actually want the vaccine, saying there's a 30% cohort that doesn't, you're looking at the end of fall. That kind of timeline, people are going to be losing their businesses. They're going to be going nuts. What is, is that just the reality? If those are the numbers, can you please say them? If they're not, what's the option?
Yeah, Gary, when you did your math, did you account for the fact that it's 2 doses?
Right.
Yeah, so so I think it's even worse than
yeah. You basically have to add three weeks onto.
Well, you have to,
I don't have
double.
that.
You have to double the number of doses. So I think your scenario is even worse.
Right.
I think if we have the supply, we absolutely need to be vaccinating at more than 12,000 doses a day. But I do think actually fall is a potentially feasible target to be able to get to the level that we think maybe we need to get to. But as I said in the earlier question, I don't think it's that you cross a bright line at the point that you reach that target. I think if the vaccine works the way we think it works, we should see a significant drop off in fatalities relatively soon because of that focus on long-term care. And if the vaccine prevents transmission, we should begin to see an improvement in the rate of illness in the community as we go, and we should be able to step down that tiered risk structure before we get to full-on herd immunity.
Hey, Pat, does the state have an official stance on breaking through the intellectual property laws so that we could start making some generics out of these Pfizer and Moderna? Basically, they don't want to give them up. But if the president said, sorry, national emergency, we're taking it, and they've done that in the past, does the state have any position on that? Would that help things?
We've not. We certainly at the health authority have not looked at or taken a position on that issue. Other parts of state government may have, as a generic issue. If there are things that can speed up production, that's a good thing.
Yeah. Okay, thank you.
Our last question is from Drew Reeves at KPTV.
Hi there. Can you hear me?
Yes.
Okay. We've been getting some messages from viewers who are upset or confused. They're seeing posts from, say, like people who work in the marketing department at hospitals getting vaccinated, and they're wondering why some of those employees are getting vaccinated over people who work in, say, like a private practice. I know you discussed this kind of pilot program earlier. I'm wondering if that is the only way you're reaching out to find these healthcare workers who do, say, work at like a private practice or something like that, and kind of how you're ensuring that the people most likely to come in contact with COVID-19 are getting this vaccine or being prioritized.
Yeah, let me tag team this one with Dr. Hargunani a little bit. And to the first part, we have become aware of vaccinators, vaccinating staff going beyond the 1A category definitions, which are really people involved in with risk of patient contact. So not necessarily just doctors and nurses, but a wide array of people. But the key is contact. Earlier today, in a conversation I had with some reporters, I had been given to understand that those were fairly isolated. Over the course of the day, I've learned it's actually quite a bit more widespread. And so we're providing some very direct guidance out to vaccinators that we are still in category 1A, and that that we shouldn't be moving on to people who don't have patient exposure. In terms of primary care practices and those kinds of things, Dr. Hargunani, you want to speak to that?
Sure. Thank you, Director Allen. So I think this is definitely work ahead of us. We know that there are practices that may have partnerships or affiliations with some of our hospitals, and we expect that those routes will be made further available now that we're moving beyond that very first group, as we mentioned earlier. We also know there are some large practices out there through our work enrolling providers and survey to understand the employees, for example, at a large practice site. So we're teeing up to be able to start delivering to sites that can vaccinate a large number of employees. And again, some of the examples of partnerships to be able to reach some of the small independent practices, for example, who may not be able to receive, a bare minimum of 100 doses, for example, but will need to partner with local public health or others in their region. And so we are really making that shift right now to move towards those types of avenues ahead.
All right. I want to thank you all for joining us today. I want to thank our speakers, Director Patrick Allen from the Oregon Health Authority, Dr. Dana Hargunani, Chief Medical Officer at the Oregon Health Authority, Joe Nest from OHSU, and Melissa Unger from SEIU. We will be back next week with our weekly COVID-19 media briefing, and I invite you all to join us again. Also, I want to remind you that we do have a Facebook Live scheduled for tomorrow at 12:30 p.m. You can find that on the Oregon Health Authority Facebook page, and that will feature Dr. Dean Seidlinger and Lex Thang. We'll be talking about updates on our data dashboards and the latest on the COVID-19 pandemic in Oregon. Thank you very much.